Hello, my name's Jane Guernsey and this is my video. Today I want to introduce you to Adlerian lifestyle assessments. This is where you would measure personality based on the self-created individual. Stay tuned if you're not familiar with Adlerian psychology. The first thing that you want to keep in mind when the client presents to you and you're going to assess the presenting issue is Alfred Adler's law of movement. Alfred Adler always said, watch the movement, watch the movement. And why is that important? Movement is synonymous with behavior. So that is how we understand behavior. So we seek to get this sense of an individual's law of movement, and as this person experiences applicable to that individual variant, it's an experience that's unique. A unique creation of working out a situation unlike any other. We expect this to be useful, congruent to mental health. The vertical plane, as we see it, movement that is focused on self-elevation at the expense of community, and a presentation that is superior to others, compensating for fears of falling short, preoccupied with self-image, how am I doing, hypersensitive to opposition or criticism, and regards others as adversaries or posing a threat to self-worth. So what would that look like if someone's presenting with psychopathology? In this decision tree, diminished self-worth means movement to the useless side of life, diminished safety, security, and belonging. Entering subjectivity creates mistaken beliefs, arrested development of social interest, and movement shows discouragement through the lens of life tasks, love, friends, and work. So now we see the client has a problem, which will generally show up in one of the three life tasks, in their love relationships, their friendships, or on the job. Sometimes this is a combination of those things, prompting the client to make an assessment appointment and thus having a presenting issue. So there's a lot here. Three core elements regarding assessment. The presenting problem, which establishes relationship between the client and clinician. It's your life situation and the life tasks we talked about. The assessment, which is the investigation or your lifestyle inquiry with spontaneous early recollections. And trust but verify, strengths and hunches verified with the client to find the common ground as equal. What constitutes this inquiry called lifestyle? There's childhood features that expressed in movement are key to convictions in the lifestyle. It's an imaginative reconstruction of pattern fitted into the context of a whole, a felt minus and a line of action to a felt plus. There are 7 of these key features that are worked into a lifestyle assessment. So in the person's line of action throughout life, they have discovered masculine and feminine guiding lines of their parents or role models. That would be adult models. The way that the atmosphere is in the home, the values of the family, whether that's education or physical fitness, multicultural factors, what birth order, organ inferiorities, and opportunities in the environment. Somewhat of the usual for the assessment interview, collecting the demographics and contact information, data collection. Make sure you're finding the hidden meaning behind some of this information. If they go to the life situation too quickly, make sure you get context or you'll miss things. From the basics, you want to go through the childhood history of those 7 elements previously mentioned, medical background, exams, referrals. So most key, we really need to talk about early recollections, or ERs as we call them. Before the age of 10 is critical. You really want the memory to be younger. They should be spontaneous when the client says, I remember when I was 5 years old, that's a good time to take a ER. Slow the client down and get it word for word verbatim. Read it back to them, get the most vivid moment, and what the most vivid feeling was. With a further look at interpretation, complete the summary of the family constellation first before you start dissecting ERs. Lead the discussion with a client and collaborate the recording. The therapist ascertains the ER meaning and uncovers an attitude or conviction the story expresses. The object of discussion and imagination is needed. Is to see the vantage point of the client. That is to say, discover how self, others, and the world looked to the client in the ER moment. You really have to get into their experience to get good at this. It's kind of fun. So, if we're going to look at ERs or early recollections, we're going to gather insights from the lifestyle interview and early recollections. There's many methods to do it, but I like to do the beautiful mind technique. You go back through your ER after collecting everything verbatim and search out sensate words and strengths of the person using a different color, circle, highlight. All right, moving back into interpretation, strengths, hunches, Socratic questioning. I'm wondering, I'm curious, is this you? Self-image. I am, for example, hardworking. Self-ideal. I should be appreciated. Life is exhausting and overwhelming. Okay, so further collaborating some convictions. I have done a spontaneous job here of over-exaggerating, which may or may not be my private logic. I should be significant because of all I contribute. Women are trailblazers and burden bearers. Men are selfish, unfeeling users. People are self-absorbed, and life is arduous to keep up with. I should take more cat naps. If I identify strengths that are overused, that shows my challenges. I've looked at hunches and verified them, and interpret the usefulness of my client's movements and subjectivity, examine current states of life tasks, and consider the question, well, if it could all be different, what would that look like? I would live a more restful, enjoyable lifestyle. I should be more at ease and enjoy life. Women are not always trying to get everything done, and men are often generous people. People in their generosity, in their giving and loving. Life is arduous to keep up with, but if it was different, it would be enjoyable and things would be measured with proper balance. I should think about how to put a treatment plan together for myself. So stepping back here, having generated treatment plan goals with the question, an Adlerian technique, you construct a collaborative treatment plan with the client, knowing that the lifestyle assessment and interpreting ERs is what Alfred Adler meant by to see with the eyes of another, to hear with the ears of another, and to feel with the heart of another. Prescription for Jane: have more fun and have the courage to be imperfect. I'm Jane Guernsey. That was my video. You saw my finger there for a little bit. and I salute you. Those are pens. Goodbye.